and welcome to Talk Trillium, Partnering for Patients. I'm Patty Cochran, Senior Vice President and Chief Innovation Officer at Trillium Health Partners, which includes the Credit Valley Hospital, Mississauga Hospital, and the Queensway Health Centre. I'll be your host as we take a look at how Trillium Health Partners is working to create a new kind of healthcare for a healthier community. And today we'll be focusing our discussion on the seniors population and the services and programs we have both within our organization and in our community to assist seniors. Today I'm really pleased to welcome our guests, both experts in the field of seniors. Dr. Paul Philbrook, he's a family physician and also Chief and Medical Director of a program which has a very long name called, let's see if I can get it right, he's Chief of Primary Care, Rehab, Complex Continuing Care and Senior Services at Trillium Health Partners. And joining him is Priti Patel. She's our expert lead in seniors, again, the lead for the same program. So they work together. So maybe I'll start with you, Paul. If I could ask you, you must see a lot of seniors in your practice every day. And based on your experience, can you tell us a little bit more about what you see as some of the emerging issues and challenges with the seniors?
Well, thank you, Patty. First of all, of course, people are living longer, which is great. They're living longer, they're spending more time with their family, that's important. As they're living longer, they're also, their organ systems are aging as well. And we see this over a continual period of time. I've been with the same people for 30 years. And as that happens, we see changes in, for instance, brain. So there are things like dementia, strokes, Parkinson's, heart. With atrial fibrillation, which is an irregular heart, congestive heart failure, lung diseases, chronic kidney diseases, systemic diseases like diabetes, arthritis with pain. And because of these changes that take place in many people, a lot of people are taking multiple medications as well. And as they take multiple medications, they get into drug interactions and side effects of the medications. All of these things lead to issues around memory changes, confusional states, for instance, falls, which is a very important problem, incontinence because of pelvic floor changes, and just living with the chronic diseases and how that affects their quality of life and pain and things like that. I can give you a little story that I'm most familiar with, but an older lady that I know who I call Mom.
And we all tend to have a mom.
We do,
a mom,
we do.
Yes.
Yeah. Well, some years ago, my mother started to have some problems with her memory. She also had high blood pressure. So she wasn't taking her medications as she was supposed to be taking them. So we got her one of these blister packs. You know, these blister packs where the medications are all lined up for them. That worked for a while until her memory continued to change and she started taking them randomly out of the packs. So I thought, okay, this doesn't work. So I said to my brother who was living with, she was living with him, you got to start managing her medications for her. He did. So for the first time in a couple of years, she started taking her pills as she was meant to take them.
Important.
Except that we didn't realize she was actually overtreated when she took them all properly. She got lightheaded, she fainted, she fell and broke her hip. And all of these things happened to my mother, one person. She had a chronic disease, 2 chronic diseases actually, not unusual at all. Dementia and high blood pressure, medication side effects, a fall that was life-changing, at least for several months. So these are the kinds of issues that we see in geriatric care frequently. Many people with many diseases and disorders, lots of medications, and the problems that arise from that. Falls, memory changes, pain, chronic pain is very important, and of course the effects that this makes on the family and the people who are taking care of them. Many people are going to work still and trying to take care of their parents at home.
Yes, we often call that the sandwich generation.
The sandwich generation. The caregivers who are strained to do this. We have to take account of them too. We have to be very cognizant of their needs and their capacities.
So it sounds like a lot of challenging issues. Thankfully though, we do have programs and services available out in the community, so our show will help to focus and demonstrate where we do have support for seniors in our community. So maybe I'll ask Priti right now, are all of these issues part of the normal aging process, and what kind of support and help do we have for seniors?
So there are some things that are a normal part of aging. So as we age, our vision will change, our hearing may change, and then there's the diseases that are associated with aging. And as Dr. Philbrook mentioned, dementia is one of those diseases, and that's not a normal part of aging. So with dementia, you know, things like that you do day-to-day changes. So for example, you're no longer able to cook or pay your bills. And there are services available to have an assessment completed and really go through your health history and give you recommendations on next steps, health teaching.
And so what should people talk about with their families while they are healthy and well?
I think it's important to talk about what you want. So if you should have a life-threatening illness, what would be your wishes? What types of treatments would you want? What types of treatments would you not want? And I think it's never too early to start having that conversation. And there's actually on the Government of Ontario website, there's a great kit that can walk families through that process as well. And some families also may want to get a lawyer to help them with some of that piece as well.
So, go ahead.
Just to add to that, it's very important, especially when you get to these later years, to have these things in place so that the caregiver doesn't have to guess and try to understand what does mom or dad, what would they want at this point in their life. If it's established, if it's clear beforehand, if all the powers of attorney are in place and all the advanced planning has been done, this makes it easier for everybody.
That's great. We know that our seniors population is expected to grow by 175% over the next 20 years. And we know that the demand on healthcare in terms of our hospital needs, we anticipate that we'll need almost close to 1,000 beds within the next 20 years. So it's important that we get ahead with appropriate planning for seniors and have the programs and supports we need. I know that Dr. Barbara Clive, we invited her today, but she was unable to join us. Can you speak a little bit more, Priti, perhaps, on some of the programs and services that she's helped to lead, and also the support the LHIN provided for us?
Yeah, so Dr. Clive, she's a geriatrician, so a physician who really specializes in caring for older adults. And Dr. Clive's been instrumental in setting some of the vision for senior services across the region, but also really serving as an advocate to increase the number of services that we have available. And through the last 3-4 years, the LHIN has, through the Aging at Home strategy, funded a number of services within our LHIN. For example, urgent geriatric assessment clinic, an outreach team, falls prevention programs.
So lots to thank Dr. Clive for, as well as our LHIN, for funding those programs and services. You mentioned a little bit about falls prevention. I'm just wondering if we should talk a little bit about the Strong and Steady program. Mm-hmm. We do have a video clip about the Strong and Steady program, so let's just take a look at that now.
People come to this program, and usually we have 10 to 14 participants for each circuit. And they receive an hour of education and an hour of exercise twice a week for 6 weeks.
So, welcome to the exercise part of your Strong and Steady.
Part of this program is also, we meet with them individually to try to also get them thinking after the program. So the program's really just a stepping stone. What's really more importantly is what's going to happen after the program. The program is focused on helping them to be more confident, to strengthen, and also for balance, and to be knowledgeable so that they're able to carry on, and ideally to carry on with physical activity.
So try to keep your eyes up. That's it. Chest is up.
One of the things that we felt quite passionate about is even though it's a hospital-based program, we felt very strong about having this program in the community. The focus is on wellness, the focus is on health, and the focus is on community integration. The clinic is actually at the hospital, but then people come to the community facility where they participate in this program twice a week.
2 and 1.
We're very proud of the Strong and Steady program. It is a partnership with our Trillium Health Partners, and we really are trying to bring the community into our facility. The Senior Center and the programs that we offer for our older adults are really geared to keeping people active as they move through their lives. As people age, there are more knee problems, there are more hip problems, back problems, and really we're trying to keep people involved in recreation and quality of life.
When I first came, I was using a cane, and now I don't need it. I've seen progress, and I here again seen the example of others, how they have come along. So it's that interchange of encouragement which really helps everybody.
We gear our programs to help people stay independent and to stay able and capable of doing day-to-day things, even coming into the facility. That's a big step for a lot of people.
Now he can wash the dishes now. Before he doesn't do anything.
They lose their independence as they lose their mobility. We want to stop that, turn the clock back, slow that process down.
It was positive right from the start, you know. And see, when I started, I wasn't able to stand up, to get up from a chair or so, but right now I'm quite good at that.
Good, everybody.
We do talk to the people in terms of the experience, and the feedback we've received from them has been incredible. They love the social, the bringing the people together, the connectiveness. People don't know each other, and within 6 weeks, it's unbelievable what transforms. It's wonderful to have the whole interprofessional team, and we're all working together and to work in partnership with Parks and Recreation. It's the whole collectiveness that makes it very enjoyable.
What a great example, the Strong and Steady program of partnership with the City of Mississauga and Trillium Health Partners to support seniors out in the community. Clearly, it's had a great impact for patients, including my own mother who attended that program. Stay tuned for Talk Trillium. We'll be discussing more about the seniors programs after a short break. Welcome back to Talk Trillium, Partnering for Patients. I'm Patty Cochran from Trillium Health Partners, and we've been talking about seniors' health. With us have Priti Patel and Paul, and joining us now is their colleague, Laura Robb, clinical nurse specialist. And before we get into your topic, Laura, I just want to circle back to the Strong and Steady video that we just saw. Priti, can you tell us a little bit about what makes this program so successful?
I think one of the big pieces is the social element. Many seniors don't have an opportunity to get out of the house, so this is an opportunity to meet new people, to have fun, and it's a combined approach. So not only are you learning and increasing your knowledge about how to prevent falls, or if you are having a fall, how to protect yourself, but you're also learning new exercises and physical activities. And it's out in the community. It's right where you live, so you don't have to travel to the hospital. It's right there in your local community.
I also noticed the spouses of the individual patients attending the program were also attending, and likely they received some valuable tips as well.
Absolutely. So many times we have husbands and wives coming to the program together. Other times their loved one might be there and they're supporting and coaching. And yeah, you will absolutely learn some tips yourself about how to protect and prevent falls.
That's great. So now I'd like to turn our attention to another program, a different program. It's the Regional Continence Program. And Laura, you're a clinical nurse specialist within that program. Continence issues are something difficult to talk about, and yet I think it's a fairly frequent occurrence. Can you talk a little bit more about this?
Yes, certainly. Becoming incontinent is not a normal part of aging, but the rates of incontinence seem to increase as people age for many reasons. And many people are quite reluctant to speak about this with even their family physicians. And so it's an issue that people don't talk about very often.
And I would imagine it's quite troublesome to have incontinence.
Yes.
So how would our viewers go and get help?
Well, we do have 5 continence clinics in the region, and one of them is in Oakville, one in Milton, one in northern Mississauga, and there's 2 in Etobicoke. And people can actually self-refer, so that we do have one number they can call to refer themselves. They also can be referred by their family doctors or by their specialists.
And the one number to call, our viewers would be able to find that number on the Trillium Health Partners website?
That's right, yes.
That's great. So that's trilliumhealthpartners.ca.
That's right.
That's wonderful. So once a patient or an individual goes to the regional continence clinic, what kinds of interventions do you provide, or what do you teach them?
Okay. Well, first of all, the clinics are run by a nurse specialty called Nurse Continence Advisor, and we specialize in conservative treatment. And I tell many people that I can't give them drugs or do surgery, and most people are very happy about that. So we help people with issues such as having to get up to the bathroom very often at night, going to the bathroom very frequently, leaking urine when they cough or sneeze, or when they have a strong urge. We also help people with constipation, chronic constipation usually, and we also help people with fecal incontinence. The other area that I haven't mentioned is we often teach people how to use a catheter if they need to learn to do that for themselves. So we specialize in conservative things such as helping people avoid certain fluids or foods that can aggravate the situation, strengthening their pelvic floor, learning how to retrain their bladder, learning how to eat foods that can help alleviate the constipation.
And what type of foods would those be?
Well, the type of foods that we encourage people, of course, the first thing we suggest is foods high in fiber, but I always encourage people to start the fiber very slowly. Otherwise, most people give up on adding that. So add fiber and fluids, and then I think the other thing that's key with our clinics is that we can give ongoing support. So it's not just one meeting. We will see people, 2 to 3 times and sometimes more.
And what's the right thing to drink? I wasn't aware that the...
Well, the wrong thing to drink for your bladder is probably coffee.
Oh, that's really
and alcohol.
And alcohol. So coffee and alcohol are 2 favorite things.
Yeah, so those are not the best. And I always, for most people, water is the best fluid.
Water is the best fluid. And you must see continent issues in your practice as well, Dr. Philbrook?
You certainly do, and of course it's different for men versus women. From my perspective, of course, the important thing for me is to try to understand the causes as well, which Laura is very much engaged in. Taking a careful history and physical exam, trying to make sure that we understand what's going on, what's happening here, what can we do to mitigate that and reduce that issue, as well as deal with the actual incontinence problem itself, which is, of course, a personal and social concern.
And it's good to know this is such an important issue that there is no fee for these services. So that's great, and it's good to know about this program. We also wanted to ask our community if they had any questions around seniors' health. So let's take a quick look at a question that's coming from our community.
People with dementia, when they talk about sundowning, what does that really mean?
Wow, that's a great question. I've never heard of the term sundowning, and I've been in healthcare for too long. So Priti or Paul, can you explain what sundowning is?
So usually individuals, not all individuals, but some individuals who have dementia, for example, we will become more confused, agitated, restless as the sun goes down. And they may have trouble sleeping. There are things that can be done. For example, increasing the activity during the day, making sure having proper meals and keeping hydrated. And there really is no known cause at this time for that.
And Dr. Philbrook, in your practice, do you see patients with sundowning?
We do. We do. We see it in the context of a dementing illness, and of course it's stressful for that individual. That individual is expressing a lot of anxiety and is not happy at that time. And although we don't necessarily understand it, we can try to do things to reduce the risk of it. So make sure the person is properly oriented, make sure the person is comfortable, not constipated, is well hydrated. Reduce those things that we can treat and deal with.
So is Sundowning associated with dementia?
Yes, we see it in the context of dementia. It's a phenomenon that we don't understand, but it seems to be happening at that time.
I do know that diagnosing dementia is a service that is provided within our seniors clinics at Trillium Health Partners. Can you describe some of the other services that we provide within that clinic at Trillium?
So when you come to the clinic, you're seen by a geriatrician or a nurse practitioner that specializes, that's a specialized nurse, and they will go through your health history, they will talk to you about your health needs and any concerns that you're having, and they will then provide you with recommendations, and they may change your medications, they may send you for additional tests, and then they may also bring you in for a follow-up, and then they'll communicate with your family physician about your diagnosis and your treatment plan as well.
So it sounds like you have to be referred from your family physician to go to the specialized clinic.
Yes. So the majority of the specialized services, you do require a medical referral. And part of it is we want to make sure that there's ongoing communication with your family physician so that you're well supported. Both, in the hospital setting, but also in the community.
And Dr. Philbrook, can you tell me a little bit more about why is it so important for seniors to have access to a specialized clinic and service?
Well, these are special issues and special problems, and the specialty that's provided by people like Priti and Laura, the special care that's provided there is so important in understanding their needs, treating their needs most effectively, and ultimately keeping these people healthy and active in the community as long as possible. And as Priti has pointed out, it's very important that everybody works together. So the family doctor needs to be part of this team as well, and there needs to be good, clear communication. As you pointed out earlier, our population of geriatric people is going to expand greatly. How are we going to deal with that? And one of the ways we must deal with that is by working within the community itself, and to increase services, to increase capacity for services, and to keep them as healthy as long as possible.
And providing tips, I would think, for family members who have to support their loved ones at home.
Absolutely. The role of the caregiver is extremely important, and they must be supported too.
And so just to refer again, how do patients access the specialized clinic?
Medical referral, so talk to your family physician. So you know your body the best. So if you're noticing changes that are not normal, talk to your family physician, and they'll probably do an assessment and then refer you to, so the referral form can be downloaded from our website, and we also have a central intake number that you can call as well to get the referral form.
And are family members welcome to attend?
We encourage that, actually. So we encourage wherever possible for your family members to attend, and they're part of your story.
And any last tips for all of us who want to prevent aging and stay healthy and well?
Do what your mom told you. Eat properly, get your sleep.
Avoid coffee and alcohol.
Be physically active. Yeah.
Staying physically active is also key. Sure. And being physically active doesn't mean necessarily that we go to the gym and do aerobics. I understand walking is just as
Walking
as
is
healthy.
Absolutely fine. Walking will accomplish the things you need to get out of activity, out of exercise. Also be socially active. Don't be isolated. Don't let yourself get into a position where you can become depressed.
Social networks are really important,
Very
so
important.
keep our friends close to us.
That's right.
So I want to thank you for taking the time to be with us today. Laura, Priti, and Dr. Philbrook, you shared a lot of great information for us, and we'll continue to develop our programs for seniors as we go into the future. So thank you, and stay with us for a short break. We'll be back with the Alzheimer Society. Welcome back to Talk Trillium, Partnering for Patients. I'm your host, Patty Cochran, and today we've been talking about seniors' health. Joining me now from the Alzheimer Society of Peel are Brandi Deimling, Business Development Coordinator for the Alzheimer Society of Peel. Welcome.
Thank you.
And Taryn Bolt, Psycho-geriatric Resource Consultant.
Thanks, Patty.
Welcome today. So, we've heard a lot about Alzheimer's recently. Can you tell me how frequently we have Alzheimer's within the Peel region?
Sure. So within 2010, a study called The Rising Tide came out to really show the trends and where Alzheimer's and dementia was going to go and how we're going to see the prevalence throughout our communities. So right now, to just put it in some context, 1 person every 2 minutes in Canada actually get diagnosed with the disease. Now for Peel, they're estimating that around 2020, we're going to actually see over 40,000 individuals affected by the disease. Currently in Ontario, we have over 250,000 individuals already affected, and that also grows and affects their families and caregivers and community agencies who are providing those services as well.
So Alzheimer's is growing within our region, and I'm sure you're busy planning for the future. We spoke a little bit earlier around dementia, and can you explain the difference between dementia and Alzheimer's?
Sure. I think the easiest way to explain to our audience what it is you look at dementia almost like an umbrella. It's a set of symptoms, and from that we then get particular different forms of it. So Alzheimer's would be a subset. So the best analogy that I can use is we use cancer. It's a very general term relating to a certain set of symptoms that we have, but we can have various forms. So we can have breast cancer, colon cancer, prostate cancer, and it's very similar to dementia. So again, it's that generalized set of symptoms, and Alzheimer's is just one form of it.
Forgetting things is something that we all experience in our lifetimes. I know we do it in our 20s and our 30s and our 40s. Can you explain a little bit to us about what would be some of the first signs and symptoms of Alzheimer's or dementia that we should be concerned about? Taryn?
Yeah, absolutely. That's a great question. I think it's difficult to pinpoint what the specific symptoms are. There's no one symptom that comes on because everybody has a different journey and a different progression through the disease. But generally, people may typically see more difficulty with short-term memory. So perhaps your loved one is forgetting to take their medication or taking it and then forgetting they've taken it and taking it again. You know, leaving a pot on the stove, so some concerns around home safety and letting the pot burn on the stove, forgetting to turn the stove off, those kinds of things. You may also see people who used to be very neatly dressed and now they have a lot of trouble with their personal hygiene. So someone who continues to wear the same outfit day after day. You know, maybe they're not showering, they're having a little more difficulty with that. You may also have a loved one who's having some trouble with word finding or who is kind of telling you the same stories over and over again or asking you the same questions. You know, when are you coming to visit? When are you coming to visit? Even though you've had those conversations with them. So those can be some of the typical signs.
And so if family members are observing those kinds of signs and symptoms, do you have any advice for them?
Absolutely. Well, I think it's really imperative to follow up with your doctor, and because some of the difficulties that you're having with your memory may not be related to dementia. It may be related to a thyroid condition. Sometimes when people have depression, they also have trouble with their memory, so it's good to go and get it checked out and rule out what some of the causes could be.
And it's quite normal also for us to forget things from time to time.
Oh yes, I know I left my keys the other day and couldn't find them, so it definitely happens to everybody. So that does not mean that you're getting Alzheimer's for sure.
And I think the important thing to remember is that Alzheimer's or dementia, it's not the typical form of aging. This is an illness that you do have to seek attention for. So, you know, I'm the queen of Post-it notes and I have it around my, my computer screen all the time. But when we're wearing our parka in July and not understanding that it's summertime, those are the red flags that really need to be looked at.
Great. I think we want to take a moment just to ask our community what questions they might have.
I looked after both my mother and father, who lived in another city and traveled every weekend to do so. Mom was in a nursing home and Dad was in his own home. It was really stressful. I'm just wondering what could have made it easier for me and people like me.
Wow, what a great question. Earlier in the show, we were talking about the sandwich generation and how we're often caught with full-time jobs and children and parents and aging parents. And that question really illustrated what a challenge it can be. So can you talk to us a little bit about any kinds of programs or services that you offer?
For sure. One of the really great programs that's available is what's called Caregiver Recharge. So that offers, I believe, 365 hours for basically caregiver respite, and that's available in the Mississauga Halton LHIN. And I think it's unique to Mississauga Halton because when I used to work in Toronto, that wasn't something that caregivers could access. So that means that the caregiver can go out and do the things that they need to do, whether it's grocery shopping, maybe going to work, you know, getting your haircut or having your own doctor's appointment, because many people who are caregivers also find that they are just having a lot of stress from caregiving, and caregiver burnout is unfortunately very common.
So 365 hours a year, I think that is?
Mm-hmm.
And is that available 7 days a week?
I believe so, yes.
And how would our viewers access those services?
So one of the ways you can access that is through your CCAC case manager. You can ask them for a referral.
What's CCAC stand for?
So that's your Community Care Access Center.
Okay, that's great.
Yep, and you can also talk to the Alzheimer Society as well, and one of our amazing counselors can make a referral.
So can you talk to us a little bit more about caregivers and what burnout feels like for them and other ways of meeting that challenge?
Absolutely. Well, I think a lot of caregivers, in addition to trying to have their own lives, you know, they may have children and a full-time job. Caregiving on top of that is another full-time job. So it's like having two full-time jobs. So you can imagine if you're trying to care for your loved one or your elderly parent, it can be quite difficult. They have appointments. There's a lot of people that can be involved. So it's difficult to sometimes coordinate all those things and keep track of all the people that are involved. Sometimes with Alzheimer's, the patient will have what they call sundowning, which is when they're up more at night and they become more agitated in the evening. And that unfortunately can be a real cause of caregiver burnout, just because you can imagine if you were up all night, every night, you know, with me, your elderly parent, and then you have to get up and get your kids ready for school and go to work tomorrow, that can really quickly burn you out just from lack of sleep.
So recognizing the risks for caregivers, what kinds of programs do you offer within the Alzheimer's Society?
So the Alzheimer's Society, we offer programs for both the person with dementia as well as the caregiver, but we do keep in mind that even though we're serving the client with dementia, these programs can also provide a source of respite for our clients as well.
The term respite, can you explain respite?
So respite is a break. That's really what it is for caregivers. It's that time to recharge, to be able to do the things that they can do while their loved ones are being stimulated and engaged and taken care of. And they can actually step back, relax, and have some me time or some mental health time, which is so important nowadays when you're caregiving. So Alzheimer's Society Peel, we actually offer a respite care program, which is our Norris House. It's a beautiful guest bungalow in Mississauga. It's open 24 hours, 7 days a week, and individuals with dementia can go there. They're stimulated through the day through Montessori-based dementia programming, and then at night they're taken care of with our staff, and then caregivers can take a break. They can go grocery shopping, they can sleep, they can spend time with family, they can go away on vacation knowing that their loved one's taken care of. Now, if they don't want to do an overnight, we have day programs which allow a person with dementia to go between the hours of roughly around 8 o'clock in the morning to about 6 o'clock at night, but that time can vary depending on their personal preferences. And again, it's allowing that respite for our caregivers, but the person with dementia is now engaged in activities, they're being socialized, they're not socially isolated anymore, and they can be active and remain independent. Our caregivers can also take advantage of our counseling services, our support groups that we offer, the public education on various topics, because what we like to say is knowledge is power. So the more that you know and can boost your confidence when you're caregiving, the easier you can see the journey ahead of you. And the more supported you are through certain services, the more you have to draw from when you are coming into those times of concerns with your loved ones. You'll have that network of support or a continuum of care.
Now, I've heard something about bathing services. Can you explain what bathing services are?
Yes. So our organization was very lucky to receive some funding to open up a portion of our day program at our Brunel location to offer bathing to clients who may have difficulties at home because their washrooms are not accessible for bathing, or now we have caregivers who are elderly themselves and not able to do the personal care that is needed. So they're able to come to our location, which is, you know, a beautiful spa-like environment with fuzzy white house coats and slippers and amazing towels, and be bathed by professionals. And families have the opportunity to learn strategies so they can actually do it at home, or take the time and have their loved ones be able to use the accessibility washrooms that we do have. And Taryn, I'm not sure if you had any families that used it and can speak to their experience.
So we often have families that use it who have some behaviors, so maybe they have a client who hasn't really historically wanted to shower, or they really are afraid of the water, or maybe they become a little agitated just around the shower time. So sometimes coming to the day program and being in a new environment. Also in the day program, I can go in and work with what we call our CSWs, or our community support workers, who actually have specialized dementia training, and they can kind of help make that a more inviting environment for that person and use those strategies to help get them to have a shower.
Wow, those are great services. It's really good to know that those services are available in our community. So thank you for joining us today and sharing those services with us. I'd like you to stay tuned. If you want more information about the Alzheimer's Society, please look at the Trillium Health Partners website, trilliumhealthpartners.ca, and stay tuned. We'll be back to hear from Ray Applebaum and more around supports for seniors in our community. Welcome back to Talk Trillium, Partnering for Patients. I'm your host, Patty Cochran from Trillium Health Partners, and today we've been talking about seniors' health. Joining me now is Ray Applebaum. He's the Executive Director of Peel Senior Link. Ray, you're no stranger to Rogers TV.
No, as you know, I hosted a show for a number of years, Aging in Peel. It was my privilege to work with Rogers in the community, and now I'm just delighted to be co-hosting with you in your show.
Yes, Ray, so you'll be joining me as a co-host now and again. I see you're hosting a new haircut. So
Yes, keeping up the grandchildren. Yes,
that's quite a challenge these days.
It is.
So today we'll be talking more about Peel Senior Link, and I know earlier in the show we had some discussions with the Alzheimer's Society of Peel to talk about their community programs, certainly with Trillium Health Partners as well. So can you talk to us a little bit more about Peel Senior Link?
Sure, I'd be happy to. The organization came out of, operates as a grassroots organization, and that we came out of the community need for seniors to be able to live safely and independently in their homes as long as possible, and to be able to do that in a way that we could provide services and programs and services with dignity and respect. The organization has grown from delivering services in designated seniors buildings to the broader community. So now we can really go to anywhere people live.
So your mission really is to allow seniors to live independently in their home,
Yes.
and you provide support for them.
That's correct. So what we do is deliver personal support and homemaking services, which is the core service, and that service is provided to them to enable them to carry on their lives as independently as possible with support, and recognizing that through frailty, and whether it be physical or other challenges that they're experiencing, we help them with their activities of daily living.
So can you describe exactly what you mean by activities of daily living? What would it look like if I was a frail senior living in an apartment by myself?
Yeah.
And maybe I just came out of hospital.
Sure. So coming out of hospital, what we would be doing is ensuring that your rehabilitation is on track, that our staff are working with you for everything from your physical being in terms of range of motion and helping you with that, ensuring that all of your daily needs are being met. So getting up, doing the simple things that we do every day in terms of toileting, preparing yourself for the day, dressing, making your bed. And what our staff do is that they really judge based on their experience and knowledge of the individual circumstances what they can or can't do for themselves. And we encourage our staff and the staff to the clients to ensure that we're not overdoing for people. In other words, we don't want to take away from those things that you're able to do, because we want to make sure that we encourage you to participate and be part of that, but also recognizing there may be limitations. So for example, meal preparation. You may not be able to stand at a counter for 20 minutes to prepare your meal, do the preparation itself, but you might be able to do the final cooking. And so our staff will do the preparation. So it's a matter of looking at it in degrees, and every client, of course, is different.
It sounds like a very valuable program. Can you tell me a little bit more about how you would qualify for receiving services from Peel Senior Link?
Absolutely. So Peel Senior Link is one of 8 in total providers around supports for daily living, and that program was established in collaboration with the Mississauga Halton Lynn, and we also deliver services in the Central West Lynn area and the Brampton area. And what we do in those services is really look at how do we assess an individual based on the needs that they present with, and then make a determination around the eligibility to the program first, and the ministry has guidelines around how we do that. So we're using a common assessment tool that has been established province-wide, and we use that to make a determination around both the eligibility, as I say, but also the care. So it begins to build our care plan and tells us what do we need to do and how do we need to be part of that individual's day to support them and enable them to live independently.
So as I understand it, then your services are one of 8 providers
That's
that
correct.
provide what we call supports for daily living in Mississauga, Brampton, Etobicoke area, Milton, Georgetown.
Yes. Yes, so we deliver that through a whole variety of locations. We have 10 locations across Peel, and those locations are both buildings, physical seniors buildings, and the neighborhoods that surround those buildings. We're also, as I say, able to go out into the community and care for people regardless of whether they live in a detached home setting, in a townhouse setting. So it's not about the housing model anymore. It's more about the individual being eligible and appropriate for care.
You know, within the hospital, we really noticed a difference when supports for daily living was expanded to allow services within individual patients' homes.
Yeah.
And it really, what we found is it reduced the rate of frail seniors having to go to long-term care or some other institution. So really, kudos to you and your team. The services have been really beneficial, we find, for frail seniors in our community.
I appreciate that, Patty, and I think it's that kind of collaboration and partnership that Trillium Health Partners has demonstrated working with organizations like Peel Senior Link to make it possible for us to support you in taking pressures off a hospital that really is trying to, respond to the demands and the needs of a growing public. And so what we're able to do is bring people out as earlier discharges to the community, because now we have a safe place and a care model to be able to wrap around the individual. We're also able to, through our work, prevent hospitalizations and premature long-term care placements. So when people are stable, their health is stable, that's when a program like Peel Senior Link comes into play, because we really can keep people living much longer and safely and appropriately, and a higher quality of life. They're living in the community where they have been, have always been. It's where their social networks are, and I think that that in itself is healthy for individuals.
It's great to know that we have so many partnerships available for us to support patients in our community. So it's great. We've had some great questions from our community, so let's go to our community now and hear a question from someone.
I just want to know, like I have a lot of friends, relatives, that they have their parents and they are living by themselves. I'm just wondering, how can they be well taken care of?
So it sounds like this is your mission in supporting seniors living alone.
Yes.
Do you have any other tips, safety tips for answering this question?
Well, I think a couple of things. Social isolation is really the beginning of the challenge for some elderly people. And as they have losses in their lives, whether it's their spouses or their family, it's really important for the family to surround that individual and or friends and neighbors to be able to keep an eye out for those individuals. When I talked about falls prevention really is something that we really need to pay a lot of attention to. As you know, in the hospital, many people present as a result of a fall, and it's really unfortunate. So really making sure that the home that they're living in is safe, that they don't have things like scattered rugs around the location, that their furniture is appropriate for them so they can physically get up and down. Their bathing area is appropriate for them so they can safely and appropriately get in and out of a tub if they're living on their own. And if we're starting to see people struggling with those kinds of activities, then that's the time for the family or friends to make a phone call and identify the fact that the individual may need some supports to live at home. That could start with the Community Care Access Center. That's a good place to start. They certainly know about our programs and many other community-based programs that can help them. Could be calling their physician and having a conversation with them about that. So there's different points in the health system, and I think that the great thing that's happening right now is we're really working hard together as healthcare practitioners to ensure that we have a system of care so that it doesn't matter which door you go in to get support or information and assistance. Everybody knows where to appropriately refer you to, and I think that's becoming more obvious to me, that the community is just doing a better job at that now.
We focused a lot about falls, I think, earlier in the program. You've mentioned the importance of falls. I'm going to go back to something that's maybe a little bit more basic, and that's ensuring that people, frail seniors that live alone, actually have food and sustenance that they need. What services do you have to provide for that?
Well, if you're eligible and you're in the Peel Senior Link program, then food preparation and or shopping is part of that care package. If you're not and you're living in the building or the community and one of our supervisors or case managers is aware of that circumstance, which we're looking out for all the time, we'll help make referrals to other programs in the community. So it might be Meals on Wheels, for example, which is an excellent program and not appropriate for everybody, but it's an option. There's food delivery programs in the community. More and more companies are getting involved in this, and so they recognize that they need to look at how do we bring food to individuals who physically can't get to the store, they can't walk around the store, but they still have that requirement. So there's different ways that we can make referrals. So we don't just care for the people who are in our Supports for Daily Living program, we're also looking at the broader community and what their needs are as well.
And what is the charge for these programs? How are you funded to keep going?
Yeah, so the Ministry of Health and Long-Term Care is our funder. We receive that money through the local health authorities, the LHINs, the Local Health Information Networks, both Mississauga, Halton, and Central West in the case of Peel. And there is no charge directly to the public for our services because it's OHIP insured. So that's how we receive our funding.
That's great. There's so much we could talk about in 10 seconds or less. Any last words of advice?
Well, I think that we're seeing a lot of change in terms of the healthcare practitioners getting more and more together and looking at partnerships and collaborations that will enable seniors to live independently and healthy in the community. I think the other side of it is the public being more educated, and I'd say that this type of show that you have now is another opportunity to educate the public about what is it that they can do and how can they participate, and if and when they require the support for their family members to be knowledgeable about where to make that phone call.
So thank you for joining us today, Ray, and sharing all of that information. And to, if our viewers want more information, please look at our website, trilliumhealthpartners.ca, and I'm sure we'll see you again.
Thanks, Patty.
So thanks for joining us today on Talk Trillium, and we'll see you next time.
That's a wrap.